Our next speaker is Sue Babey, senior researcher at the UCLA Center for Health Policy Research. And because we're in California, we do focus more on Latinos than other parts of the country. And we think there are lessons, as Jorge discussed, by looking at Latinos in Mexico as well as Latinos in the United States.
Yes. And I'd actually like to thank Lori for her earlier question, because it's a really nice segue into what I'm going to be showing you as just a little bit of data from California looking at sugar-sweetened beverage consumption by racial and ethnic groups. This first slide is looking at youth ages 2 to 17. The data are from the California Health Interview Survey, which is a state survey that's modeled after the National Health Interview Survey. And what we see in California is that consumption among youth is significantly higher among Latinos and African Americans, as well as multiracial youth, relative to white youth. This next slide shows sugar-sweetened beverage consumption among adults. Now, this data is actually from 2009, which is a little bit older, but I chose that because that year's survey included a more comprehensive list of sugar-sweetened beverages, so it better captures the overall consumption of sugar-sweetened beverages. And among the adult population in this survey, I was able to include some additional groups that were too small among the youth. And here we see that, again, consumption among Latino adults is higher than among white adults. Also, African American adults and American Indian adults have higher consumption than white adults. Pacific Islanders also have high consumption, but the confidence interval for that group is fairly wide, as you can see. And then finally, because we do have a fairly large population of folks whose ancestry is of different types of Latino or Hispanic groups, I'm also showing you some consumption patterns broken out by Latino or Hispanic ancestry among California adults. And here we see that, interestingly, adults who have Guatemalan ancestry and Salvadoran ancestry, as well as to some degree Mexican ancestry, have relatively high rates of consumption compared to Central Americans, although I would like to point out that that group also has a fairly wide confidence interval.
How do you define Central America if it's not Salvador, Guatemala?
Oh, so sorry, it would be, I should have said other Central American. Yeah, my apologies. Other Central American countries were combined because we didn't have the sample size to show them separately. Yes. And I only have those 3 slides, so I would like to invite questions at this point.
Should we infer that living closer to the equator leads you to drink more sugary beverages?
I
The colder the latitude.
You could infer, although I'm not sure. I'm not sure we directly speak to that entirely. Yes.
So if you go back to your first slide,
Sure.
combines kids looks like 2 to 17.
Yes.
What we see in the national data is that there's this increase as you approach adolescence.
Yes.
It goes up quite a bit. Do you find that in this population, or is it pretty much high across the board?
That's actually a good question, and we do see that in our California population, where the adolescents are have the highest rates of sugar-sweetened beverage consumption as well, quite a bit higher than especially the younger kids. And I don't have that data in front of me, but we do see that pattern here as well.